Hi, I'm Dr. Jim Hoven, your host of the Difference Makers podcast. This is a place where people come together that are making a difference for those who want to make a difference. And that's you. We're bringing thought leaders together in a sense of fusion where ideas and concepts and personalities are all driven together into one place at one time. And this is no different. In this episode, you're going to see cool things from cool people making a difference.
Well, hello, everyone. Welcome to the Difference Makers podcast. I am here with the usual star of the show, Dr. Jim Hoven.
Well, I don't know about star. We'll say host. Let's dial back star thing. But it is good to be here with you again. Man, I love these conversations where it's you and I. There's always something special because it can be about anything that we talk about, whether it's the law part of what we do, the science part about what we do, the medicine of our previous careers, or even just topics about life. And that's what makes these really special for me.
Yeah, I agree. Just life in general. You know, Dr. Hoven and I were talking just briefly there before we went on camera. And he's like, I was going to call an audible today and we were going to do this. And I love that. I love coming in here when we do audibles and we pull something off just from the hip. It's always more exciting that way.
Super fun.
And I think one of the things we've been getting a lot of people reaching out to us about, even our own staff and people asking, we get a lot of comments on our commercials. Let's just go right to the point here. And some of the commercials comments we get are, does being a doctor and a lawyer really matter? We get that a lot. We also get, are you a real doctor? Or you just have the degree? It's another thing.
Yeah, have you practiced? Have you ever really practiced in medicine?
Yes. And so today, in our brief talking before this, we decided to talk a little bit about that, about, everything. We're going to cover a little bit from injury today to even what it means in our firm and how we look at these injuries may be different than others do.
Yeah, that'd be great. I'm excited to do this because it allows us to kind of tie back in our roots of all of this and how it helps people in some examples. Like, it's so crazy. I was just talking to two different stories. I was talking to someone last night. He texts me, he goes, hey, my brother, haven't talked to you in a long time. It's our friend Sean. You remember my friend Sean? Yeah. And he goes, yeah, let me show you a picture of my new truck. He sends me this truck. I'm like, what happened to your black 4Runner? He goes, it got wrecked. And I'm like, what do you mean it got wrecked? What happened? And so he tells me about it by text. And he says, it was just a crazy thing. I said, well, did you get injured? Are you hurt? Did you have to go anywhere? And he goes, I was so blessed and lucky that I'm fine. And then on the other side, you get that conversation where you say, man, hardly anything happened to the car, but I feel like wreck. I messed up. And that whole line that you can cross in that place is something that people don't understand, right? Like, why would one person get hurt and why another wouldn't? So being able to talk with you about stuff like that, I think that's going to be huge for people today.
Well, it's incredible. And, let's just launch off into a couple examples and how we go about things in the hospital. So yes, I am a real doctor. Yes, I practiced in the local hospitals and trauma centers for 15 years, 10 as an attending at the University Hospital. And Dr. Hoven and I had clinics together where we actually treated people outside of the hospital that had more prolonged injury or illness that may affect them for the rest of their life. And one of the things, so jump back to the hospital part of the practice of trauma, that always struck me and why we taught residents all the time to work people up, to work up their complaints and listen to everyone, no matter how small. I'll never forget. And I think most medical doctors would tell you this, and I'm sure you would tell us this in the chiropractic world as well. There's a time in your practice where you're just into it, and you've been reading the books, and you understand all the chapters, and you're trying to get anal because you've just taken your boards, and you think it's all just kind of book knowledge, like something you read in a paragraph. And then all of a sudden you see a case of it in the hospital, and you're like, whoa, that happened to them? Like, that really happens? You have any eye-opening events like that in your practice?
Completely. Like, there was one time where Dr. Randy Snyder, who's a good friend of both of ours, it's where, he and I were partners, and one of the clinics that you had your clinic in where we were all together, he was off one day, I was treating, and a guy comes in, and he literally is having back pain, searing back pain. He's going through all this stuff and he's kind of sweating. And I'm like, man, let's take an x-ray real quick. Before we do anything, take an x-ray. And he had an abdominal aortic aneurysm that was huge. And so I measured it out and I'm like, oh, look, my man, we got to get this checked before I do any adjusting on you. Let's go in. And turns out he went into the hospital and they did an immediate surgery on him to kind of get control of that. Because if that blood vessels explodes, you're done in like seconds, right? So he was so grateful, and it just made me think of, I had seen pictures of it, I had seen X-rays of it, but I'd never seen one. And man, it was
before you.
It really was sobering to me, like, to do it right every time. Don't cut corners, because if I had missed that, the next guy might have missed it, and then the guy could have had a horrible outcome.
If he would have even made it back to that next visit.
Fair point.
One of the things about abdominal aortic aneurysms that you may or may not know, just to kind of change the medicine to kind of everyday terms here. So this is like if you've ever seen a tire that has a bubble on the sidewall. And we probably all have seen that. And there's a day that bubble's on the sidewall and it gets bigger and it gets bigger, and pretty quick you have a blowout going down the road. And the abdominal aorta is that part. So the aorta basically comes off of your heart, runs up, does an arch, and comes right down the center of your belly before it splits off into all the major vessels. So all of the blood in the body can be pumped out of it in seconds if it ruptures or has a hole in it. Just like that. Just like in a tire, if the sidewall went out, all of the air could come out in just seconds. And if you get this weak spot in your aorta, it starts blowing up like a bubble like that. And it gets to a critical period, a critical measurement, where all of a sudden it gives way. And right before that, sometimes you start to experience that pain, like you were talking about. And sometimes it manifests as back pain, because a lot of abdominal pain will radiate through to the back, or some abdominal pain even radiates up to the shoulder. And so, great pickup, and probably saved you guys' life.
Thank you. Yeah, it was a humbling experience, and let you know what we do,
Yeah, I'll share one with you. I had, the very first time I saw a vertebral artery dissection, we had a gal come into the hospital, very low mechanism crash. The paramedics thought she was faking. She'd been rear-ended from behind. There was no really visible damage to the car, and she was complaining of severe neck pain and headache. And, they kind of gave this report, and they brought her in. Yeah, we brought her in because she's being dramatic, and, she probably thinks she's going to, go get an attorney, probably, go get the person you see on TV all the time. And I'm like, oh, geez. So I go in there kind of half biased, right? And I walk in.
Because you're not an attorney at that time.
Not an attorney. Nope. Practicing medical doctor. And I'm hearing no, not even a paint scratch on the car. And it was kind of at a stoplight. And when she kind of got bumped, she didn't take off. The person behind her did and bumped her. And anyway, I go in, and there was something as I looked at her, and I caught that little angel over your shoulder you probably had that day that you diagnosed that abdominal aortic aneurysm. Sometimes there's something that tells you, hold on, it kind of strikes you a little bit. I looked at her, and she was very sincere. And it was just something about her pain and how she presented. And the residents had seen her, and they were kind of biased as well about what had happened. And I said, something here's not striking me right. Let's do an MRA of her. I want to see her neck vessels in her head. Something's up here. It just was a different type of presentation. And she had bilateral vertebral artery dissections. Now, what that is in the back of your spine, there are vessels that come out, and they run up, and they run basically into your skull, into your brain. They feed what we call the posterior circulation, the cerebellum, the back part of the brain. But these vessels, when they come up, they're outside the spine for part of their course. Then they course inside the spine through these little bitty holes that are along the bones of your neck, your cervical vertebral bodies. They course inside that hole before they go up inside of the cranium. And in that canal, they're subject to trauma, to twisting and yanking. And from the snapping of her neck back, just a simple snapping of her neck back with no damage to the car, she had tore both of those.
Wow.
Now, what that means is as that clot is forming, it was kind of forming there. When it closes, she gets no more circulation to the back of her brain. She probably doesn't walk ever right again, may not ever see right again or feel right again or have proprioception right in her feet and her balance as she goes. Life-changing. But if you catch those dissections and you catch them before they clot off and close, you can thin their blood out and you can keep the blood flow going through them.
Wow.
And just one of those things, small trauma, big injury.
Wow. I bet you literally, as you shared that with her and her family, they were so relieved and thankful that someone listened, right?
Yeah.
And that's a big thing, I think, in every profession, whether it's healthcare or in what we do now on the legal side. Like, do you really listen? Are you paying attention and asking every little thing? What's going on? How's this affecting your life? Because I think you've seen this a million times. I know I saw it in practice, and now from this perspective on the legal side, seeing these people, how the ripple effect of a trauma, a crash, it goes out into mental besides their physical. It goes about into their sense of identity if they can't work or they can't do the things they love to do or they can't feel like they're a good parent. And that leads to emotional stress, and then the support system. Like, it's a ripple effect that you work with every day.
Completely. And, I think that, I don't know if it's just with maturity that you kind of respect it more, if through your own vulnerabilities with life and with age, that you begin to respect it more. But there's no doubt there's a huge ripple effect. There's kind of probably a period in your life where, maybe you're young and tough, you don't think like anything affects you. And then once you start to see the effects, you mentioned the psychological effects. People, for example, who have witnessed somebody get severely injured, and they've witnessed somebody either get paralyzed or killed, or someone themselves who just barely missed. They barely dodged being there themselves for one reason or another. That sets off something in their body that forever always elevates their level of neurotransmitters, or kind of that underlying adrenaline, so much so that they may not even realize it. And if you think about it, we've kind of known this since we were kids, right? What happened if you caught a little bird? We catch birds when we were kids, and we went to our pet bird, and we'd have him, and he would die. And you were so nice to him, and you didn't do anything to him. You didn't squeeze him,
Yes.
you tried to feed him, but they were so nervous.
Yes.
And sometimes they would just die. I grew up in the country, and so this was one of the things we used to do, is catch these little birds, and they would never live, so I just kind of quit catching them because it wasn't doing me any good. I never could have a pet bird. Mm-hmm. And it's because they're getting that same rush that we get in those traumatic experiences that are we see patients get, and they're absolutely real. That is, and it's lifelong. They picture that, and as we know, if you live your life with elevated blood pressure, elevated level of nervousness or anxiety or whatever it may be, it's just not conducive to a long, full, healthy life.
Absolutely. And we've had guests on here talking about that you have to work back through trauma because it will stay in your cells, right?
Yes, absolutely.
You get memory, cellular and muscular memory. And then unless you're actively treating that to work back through it, it will impact every time you experience any little trauma. It magnifies it. And so it's something that needs to be taken care of. And that's just the mental and emotional side, which we don't think about. But the physical side, talk to how someone who has had a spine injury, whether, God forbid, it's a tragic injury like what we've seen in this practice,
yes.
where you have a rollover car crash, you got a spine that gets, busted up, and a spinal cord that gets essentially half severed.
Yep.
It changes everything for generations.
Yeah, it sure does. A lot of times the trauma from the spinal injury, obviously it's severe and it's, quote, bad enough, but what comes after is oftentimes even worse. We see the complications then of people who you're immobile in one position, and we don't realize it, but as we're sitting here, we might wiggle a little bit or move just a little bit, and we all kind of do it almost like you blink. You don't even realize you blink, and we just do that naturally. And what it is our body is shifting pressure points, for example, where there's an area of skin that blood flow is going to it, but we're pressing on it. We're cutting off the blood to it. And that area would die if we didn't do that little shift. It only takes a little shift. It only takes it every 10, 15 minutes, maybe every 25 minutes. But we do it all day, every day. And when you're paralyzed, as one example, you don't do that. And then what happens if somebody's not moving you, or if you don't remember because you don't feel the pain, you don't feel the ache, that area then dies. Now what do you have? You have an ulcer. And then all of a sudden when you get an ulcer, how do you skin graft an area that you're also sitting on now?
Yes.
And then how do you keep bacteria out of that area? Now you have infection. And this cascading event goes. It's the same thing with, the sticking with people who are paralyzed. When their bladder no longer works and they can't urinate on their own, the bladder will fill up, and sometimes it just dumps on its own, just decides it's just going to, they don't know it and they don't feel it. So what they do is they just cath intermittently. They have to take literally a catheter, a straw, stick it, up in through the urethra, up into their bladder, and to drain it. Well, in doing so, it's almost impossible not to push bacteria up in there. Just almost impossible. So then they start to deal with chronic kidney or urinary tract infections. But then what does that lead to? The bladder and the urethra get infected, and then they start to let bacteria translate up the ureter, which is that part, the tube, if you want to call it that runs from the kidney down to the bladder. Now all of a sudden they've got infections in their ureters, inflammation there. Then they get some obstruction, or the infection ascends all the way up into their kidneys, and now they're getting kidney infections. And you see, it's this ongoing trail of events, and it's a nightmare. And when we take cases and when we go to trial and when we ask for money for things, it's not because, I know there's this perception that, you just want a lot of money. Mm-hmm. No, it's because we've taken into consideration all of these things and how they're going to affect this person. And the one bad thing I would tell you about law and about serious injury is that you're supposed to rub a crystal ball, and you're supposed to tell today what it's worth or what it's going to cost or what the person's going to go through for the rest of their life, for 20 years, 30 years, 40 years, whatever it might be. Because see, you don't get to come back each year and say, oh, hey, I used 170 catheters the last 6 months. I need money for another 170 more. And you don't get to come back the following year and say, I've had 2 bed sores, one led to infection, one didn't. I've had 12 urinary tract infections. My kidneys have been infected twice. You don't get to come back every year and do that. It'd be nice if you could. Mm-hmm. Then we could be very, very specific. We wouldn't have to ask for millions of dollars. We could just ask year by year. But how the system is set up is you get one bite at the apple. And that's tough. That's tough to look somebody in the eyes and give them a check and say, God bless you. I hope this gets you through however many years you have left.
Isn't that something? And you'd mentioned, like we've talked about, the small things leading to big injuries.
Yes.
With the minor bump causing the vertebral artery dissection. We talked now about the huge injuries on a catastrophic spinal cord injury. And there's a lot in between with the people that get acute pain. Some of it resolves very nicely, but those that don't, when you get acute to chronic pain, man, I know, like we both have people in our lives that experience chronic pain on a regular basis, and the way that it changes their personality and what they go through. Can you talk a little bit about why chronic pain is such a debilitating thing? Because it's like, it's just back pain, it's just shoulder, it's just neck, but no, it's not.
No, it's not. And the thing about the chronic pain that I'll tell you is the worst aspect, I think, of it is that it's usually only the start. When somebody starts to have chronic pain, well, I'll give you an example. I had asked Gabe before we started here, when I realized what we were going to talk about, to bring me in a spinal model. Because I know you've seen this in your practice, the bridging that occurs between vertebral bodies from bone.
Yes.
So what happens is, and gosh, I hope I can make this clear. It's sometimes tough to understand, but it's our spine, flexible. We have these natural curves to our spine, 7 cervical vertebral bodies, 12 thoracic, 5 lumbar. And notice the spine is holding together. It's not falling apart like a bunch of blocks. And the reason is, and if you're listening to this and you're not watching this, we're actually shooting a video as we're doing this, but I'll try to explain as if you're just listening, just in case that's the case today. In the back of the spine, where the blocks sit together, the vertebral bodies, they rub together right here at the facets, right? Mm-hmm. And how many times have you and I taken care of somebody who has pain at their facets? What the facets are, there's these little shingles where the back of the spine sits on each other, and they rub across each other real gentle, and they kind of slide on each other. When I turn my head, each of these shingles is just turned just slightly, each one maybe 1/8 of an inch, and that allows me my full rotation of my neck. There's that little sliding, and it happens right here in the back of everybody's spine where the bones come together, nice and smooth. It's almost like 2 pieces of glass with water between them. Nice and smooth. Now what happens and this goes to the kind of minor injuries becoming chronic, and chronic pain is where I'm going with this. What happens is that, for example, in whiplash, one of the most common things that people are treated for by medical doctors, by chiropractic physicians, one of the most common things that they actually come to a law firm for. They get rear-ended, the spine gets jerked backwards. When it gets jerked backwards, these facets, those shingles in the back, they scrape across each other. They just scrape across. When that happens, we start to get inflammation there. Here's the thing that Dr. Hoven and I both can tell you, most all problems in life start with inflammation.
Yes.
And we get inflamed muscles. We get inflamed, bone surfaces. We get inflamed joint surfaces. Inflammation.
Even down to the cellular level.
And now there's specific tests for it. C-reactive protein, homocysteine, all these things that we weren't testing when I first went to medical school that are inflammation markers. They talk about inflammation in the body. Okay. Well, these trauma events cause inflammation in the body. Inflammation in the body looks for a place to cause havoc. So going back to the spine here, from that little rear end tap where somebody gets a little whiplash, those facets shear on each other. Now there's inflammation. When there's a nidus or a site of inflammation, what the body does, we have a remarkable body. It tries to heal it, right? It wants to heal it. So what it does, it sends all these inflammatory cells there, all these white blood cells there, all this blood flow there. It's going to take care of the problem. Problem is it overreacts. It sends the whole army. And when the whole army gets there, then what happens is it starts to repair. When it starts to repair, it actually lays down more bone. It thinks it's doing you a great job. It thickens the surface. Well, now what? Now we have an uneven surface. It doesn't match up with the other surfaces. Now it's rubbing against each other. And where I went with Dr. Hoven early when I started this is we see often in people then, so that's the acute phase, all that inflammation and all the healing cells running there. Chronically, what we see is after all that rubbing and all that turning, the body literally will form bone bridges across the vertebral bodies to hold them in place. It's like, listen, if you move, you're going to hurt yourself. So what I'm going to do is I'm going to splint you by forming a bone bridge across here and locks those vertebral bodies in place. And that's an example then where chronic becomes an issue.
Yes.
Right?
Well, I'll tell you, could I borrow that for 1 second?
Yeah, please.
So what Dr. Ramos was talking about is present whenever you have an injury that isn't fully rehabbed. It's like if you ever sprain an ankle.
Yes.
As a basketball player or in
Yes.
football or just walking down the sidewalk, if you don't rehab it and you don't do something for it, that sprained ankle can sprain easier and easier because those ligaments are like plastic bags, right? They stretch and they don't bounce back. They're not very elastic. Whereas
Right.
muscles are like rubber and they come back much better. So just talking about me in my own situation, I have in the thoracic spine, for those of you that can see, our thoracic spine is our mid-back. And the normal curve of the mid-back from the side position should be about 45 degrees. Mine is 70.
No.
Mine is 70 because I have a genetic, my father had the hyperkyphosis. Like hyper means too much, kyphosis means that particular curve. Too much curve in there. And so I had that. And even though I've been working out and doing all these things, I've had a couple traumas, whether it was in sports as a young kid or, a couple years back, a little rear ender, but everything tightened that up. And so that now, literally, even last week, I had to go to Dr. Chris Goebbels, who you know. He has a specific, it's called scolicare. It's for scoliosis and hyperkyphosis. So he's like, man, we should check you out. So he checked me out. He's the one who measured what my curve was and given me specific exercises just for this part of my spine.
Wow.
Just posterior, really light, really small exercises. But for me, it's too late to get all that motion back because the bone bridges have been created. So when I saw my spine, I was like, whoa, because you can't see it.
Yes.
And so when you see that the bone is going over this way to keep me from going more and more, it's really sobering. And so I would love for you to talk about some of these pre-existing things that are in a body that once it undergoes trauma, if it's been like this and then it undergoes trauma, now you've got a magnified situation.
Yeah, and I'm going to start with an analogy. I love analogies, but I think it all puts it all in perspective, and then we'll go specifically to the body. So just like anything in life, if you're driving down the road and your car has 70,000 miles on it and you hit a pothole and your tires have 70,000, your shocks have 70,000, your tie rods have 70,000, and you hit the pothole, you might have a problem. If you're driving down the road in a brand new vehicle with brand new tires, with brand new shocks, with brand new struts, with brand new everything, you hit the pothole, probably more likely to make it through it. And the reason is that with time, there's a tear down and a wear down on those car parts, and they just don't take quite the trauma that they did before. And it's the exact same way with the human body. Pre-existing conditions that happen to us, they set us up then. They're like that worn shock. They set us up for the breakdown, for the failure or the next trauma. And the next trauma doesn't necessarily have to be a big one. It can be a small one, or it might be a really big one. But the point being is that they set us up. So using Dr. Hoven's actual condition is kyphosis, that excess curvature in that mid part of his back. What happens, that starts to load the structures of his back differently. Starts to be different pressures on his discs, different pressures on his facets, and as different pressures start to hit and hit and hit and wear and wear. Now all of a sudden, one little motion that might have caused 10 degrees of shift, then most people have 10 they could take. You're already 30 degrees off normal. And you're healthy. This guy's a beast. This guy works out all the time. He's incredibly strong. When you hug him, you're just like, you feel he is a strong man, but he's a setup now for injury. And it's just because of those forces across those surfaces. So there's no doubt that pre-existing conditions set us up, just like someone who might be getting a little older and their immune system gets a little weaker. Now they're set up more to infection. It's the same way with our bodies and with every single part of them. And I actually want to jump over to something real quick here. This is why we do what we do at Ramos Law. This is why you have two doctors on the screen here. And I'm sorry, I don't mean to be too Ramos Law pluggish in this. I know this is from our firm, and it is, but this is about making a difference in people's lives. And I want to keep it there in the medicine, but this is why our firm is different. We have a medical division, because this stuff matters to me. And when I was testifying all the time in court as an expert, long before I was an attorney, I would see that the attorney didn't get what I was trying to explain or say. They wouldn't even ask me the next question, like, well, Dr. Ramos, if the anatomy is abnormal, how does that then affect the forces? Oh, well, thank you for asking, Mr. Attorney. It affects the forces in this way. Well, and then what happens? Well, here's what happens. You're predisposed to injury, more severe injury. Well, then what happens? Well, what happens then? For example, when two vertebral bodies fuse, like we talked about a moment ago, or in Dr. Hoven, if you were to get a trauma, and that was the shear that started causing that more arthritis to set in there and a kind of a more, if his muscle spasm around that area, what happens is the level above and below that injured area, they carry double the weight. They do double the work. What happens when they do double the work? They get worn out. So I wanted attorneys to ask me that so I could explain, this is what this person is going to go through for the rest of their life. This is that start. I mean, and when they couldn't do that, I got so frustrated. Because I'm passionate about the medicine. Dr. Hoven's passionate about the medicine. I knew when we started this firm, I needed people like him here who are passionate about the medicine, because that's what gets the attorneys to understand. That's what helps our clients to understand. Then they go, oh, I get it. You actually don't care just about today. You care about my whole life. That's right.
Right. And you've done such a great job of putting the pieces together so that your philosophy as a provider goes out not only with the medical knowledge, like you give us information all the time about how we can all be better, from us in the executive team down to our attorneys, all getting more information about the medicine. But you've also installed what we call our medical team. And that was, I didn't want to let that go, because you mentioned that you have these people to help find these doctors, because all doctors are wonderful, right?
Yes.
There's good and bad in everything. Yes. But overall, all doctors are wonderful, of all disciplines. They all have great ideas. They all have great, they really want to take care of people. They have great intentions. But not all skills are equal within doctors. So if they've never trained on trauma, if they don't understand how the system works and how people have to go and documentation has to be just right to tell their story,
yes,
it creates problems. And so with what you've assembled with the medical team, it is people who have worked in clinics, who have run clinics, who are part of that system that came over here and can now help our clients find those doctors that do this every single day, that know how to write that story, that can get you in right now, because they know that if you delay even by weeks, it can lead to long-term consequences. So I just want to bring that out and applaud you for that, because it's incredibly unique to what we do.
Well, I'm sure, it is unique. And I'm sure you saw this when you were in your practice. How many times did you see a patient who presented you with a complaint? Pick any area of the body. And they didn't have a story sometimes. Like if you asked them where it started, occasionally they'd say, doctor, 15 years ago, I was playing football and I got hit from the side, and then, my knee hurt me a little bit. But ever since then, it's gotten worse, And as a doctor, we would get to see them 15 years after that knee injury. Or, hey, 20 years ago, I was in a car crash and I suffered whiplash. And I've had progressive headaches. It started about 3 years after that, and they've been progressive ever since. And you do an x-ray of their neck, and they look like they got an 80-year-old spine and they're only 50 years old.
Yes.
How many times did you see that?
Oh, more than I can count, where people would just come in wondering one thing, feeling one thing, and then when they saw it, they're like, I can't believe it's that bad.
Yes.
It's very common.
Yeah, and think, if you're listening to this, think about how far science has come just in our time. So, for example, you remember a long time ago in the NFL, you get a concussion? It's like, man, get back out in the field.
Yeah, get an AMCAP. Smell the ammonia, and you're out.
Yeah,
I remember it.
Get back out there. You're out there the next quarter, right? Now, they've realized over time that the second impact, and sometimes a very light impact, causes significant brain injury and significant long-term consequences. And only now has that come to the surface through all this research, now that we understand, again, how the neurotransmitters work in the brain, how the brain tissue itself responds to injury, how there may be a period of time where it doesn't get as much oxygen as otherwise would get, or that it floods itself with sugars trying to recover that clog up vessels and cause small vessel disease in the brain. Now we're getting the neurobiology, the neuroscience behind the injury, and now they take concussion protocol very serious. Mm-hmm. They realize it's life-changing. They realize that football players were committing suicide later because they had this cumulative trauma effect, and they were seeing this later. But see, we didn't know that when we were playing.
No.
Nothing like that. So the science has come along, and we're understanding, that there are long-term effects to this. And that's why when people are in car crashes, it's just like you're playing in a football game. If you get your brain shaken, somebody needs to pay attention to that. Somebody needs to ask the questions, the important questions. Somebody needs to make sure they do, as you started to allude to a minute ago, get people into excellent care. There are a lot of excellent doctors. The unique thing about law is that the excellent doctors also have to document with the same degree of excellence. Because in law, what happens is your story is told on a piece of paper. You see, if I go say, they have a serious brain injury, this could really hurt them in the future. If they have one small shake in the future, it's going to impact them. And we need to consider that future as part of this settlement. The adjuster goes, okay, that's all great, and I understand you're a doctor, and thank you for educating me, but you can't also testify for your client, so you have to have a doctor say that. I say, no problem. And when I talk to a doctor, the doctors are always willing to do it because they understand and we understand. We both understand the medicine. Mm-hmm. But if they don't, if doctors don't document it, insurance companies look at it like it didn't occur or like it can't occur. And so we find ourselves here a lot of times in the firm, and it's why I'm surrounded by medical personnel here, and we have a medical team, a whole medical division, is we care, we understand, we know, we contact the doctors who also care and understand, but what they don't know is they don't know how important that documentation was. And we make sure we get it in there because it's just the truth. It just has to be in paper for the insurance company to believe it.
And I think the worst example of that I've ever seen in our firm was a war hero. You know who I'm talking about. Yep. He came in, he drove all the way down here because you were a medical doctor and an attorney. You are a medical doctor and attorney, and he was a PA in the armed services. And he got all the way up, made all this ranking, did all this stuff, and had a couple traumas.
Yeah.
And one trauma led to the next and led to the next. And he came to us for help, and we were going everywhere. And the problem was while he was getting care, it wasn't we were trying to keep him in this lane. He was going to this lane. Because, when you have all the military benefits, you're doing all these other things, and it wasn't getting documented and it wasn't getting appreciated. And he's pretty soon telling a story that now it's so convoluted that he doesn't even know if it's true.
Right.
And at the end of the day, it cost him his life.
Yes.
And it was just to see it magnify what mental stress and multiple traumas and concussions can do. And those came from crashes. He had a severe crash after previous injuries, after being, with all these explosions and after all that stuff built up. And it took the ultimate toll on him. I will never, ever forget that, and why we need to treat things, like you said, with such care and precision with not only how we talk to them and how we basically lift them up, right? We got to embody them and tell them we get you. Because their family might not get them.
That's right.
Their providers might not get them. Their bosses might not get them because they don't see this every day. So we're at a really unique advantage, but also responsibility.
And in fact, they actually drive those people who are injured, they're suffering in that way. They actually drive the people around them away because they get more irritable.
Yes.
They're less attentive. They're more forgetful. They're just not focused. They're not with you. And frankly, they have an edge about it with all of those around them. And so what do? They're, they might be more critical of their doctor, and then their doctor gets turned off by them. They might be on their wife or their children's, rear ends all the time, just because, and they don't even realize it. It's because their whole system is ramped up. They don't feel well, and they kind of create this zone around them of trauma. And it really takes understanding that, realizing that, and helping them to understand that, hey, it's okay, we know what you're going through. We're going to get you in some help for this. And yes, it's going to make a difference. And then comforting those around them in that zone that they're trying to push away to say, hold on a minute. Trust me, you still got the same person here. We just need to get them better. And I think understanding that, I'm thankful that I work around medical providers like yourself. I'm thankful that we have a team that cares like we care because we've handpicked that team to make sure they do. I'm thankful that our attorneys really want to learn the medicine. Isn't it nice that they come to our offices and ask us questions, and they're really into it?
Yes.
I love that. That's what was missing the entire time I was testifying as an expert and dealing with all these attorneys. That's what was missing. Mm-hmm. I couldn't work here today if that was missing.
Yeah. And, I think it all boils down to when you very first started this, just you and a couple of people, your thought was what makes us different, makes us better because of where you had gone and what you'd been. And I think to all of us, between understanding our 5 core values and that particular statement, what makes us different, makes us better, it allows us to to push ourselves, to grow more and learn more about this, to have more empathy, to have more caring, to find the best providers because we want to be different. And that starts with what you saw from those days of, man, if that attorney would just ask me one level question deeper, right? And so look what's changed from that.
You know, I'll give one last example. I know we've got to end. We've been running a little bit now, over 30 minutes, but I want to give you one example of something that will always stick out in my mind. This family still sticks out in my mind. In fact, they bought me a pin that I have sitting on the front of my desk in my office. Did you ever see that pin? That came from a particular family. I'm not going to state their name here because I didn't ask for permission. But here was an example of what makes us different, makes us better. We had a person who had been in a crash. A car had come across, it ran a light and come in front of them, and they T-boned that car. But as the T-bone to occur, the lady pressed down hard on the brake like this. And when she did, her toe flexed up and her heel went down. And she ended up having a tear in her Achilles tendon. Now, it wasn't a complete tear. And you guys probably know what an Achilles tendon is, you know, Achilles heel, you hear. It was a partial tear of that. And she had heel pain from the day of the crash. But here's the problem. In a T-bone crash like this, she also had neck pain. She also had headaches. She also had back pain. She had a lot of injuries. And serious injuries. This is a high-speed T-bone crash. Well, what had happened is her other injuries got better actually relatively quickly. She did really well. She couldn't get this heel better, this Achilles better. And what happens, the insurance company said, Achilles, like an Achilles tendon injury? Sorry. We get where you had the spine injuries here, but we're not buying an Achilles tendon injury, and they wouldn't pay for it. And this ended up being so severe that she ended up getting placed in a boot for a prolonged period of time. You know what that does? All the muscle wasting, loss, abnormal gait. Now she starts having knee and hip problems. And they're like, oh, she's just a bag of complaints, right? They didn't get it. They didn't get the medicine. So what ended up happening was the insurance company blamed this Achilles injury on the fact that she had a bone spur on her heel. A lot of people get bone spurs on the heel. And you'll hear of people who then, you know, they have to walk in the funny shoe because they're having so much heel pain. And a lot of times it's related to a bone spur. They said, well, the reason that her tendon was torn, it was already torn, this partial tear is an area of inflammation. It's from that bone spur. It's not from our car crash. Well, what happened was I had an animation made and showed the motion of the Achilles and and where it was in relation to the spur. Then correlated that with the MRI image, took the MRI image, lit up where she was injured, and showed where, if you're in complete dorsiflexion, which is pressing down, toes come back towards the head, where it would place her Achilles in relation to the spur. Had the MRI image, had the animation. We go to mediation. This is just prior to trial. We were asking for like $500,000. Because this has just totally affected her life. I mean, imagine being, and then they went, there was a lot more to the story, but to make it quick, basically she went from being in a walking boot to when that wasn't healing up, they told her to go non-weight bearing to get off her foot. Then she's going around like on crutches. And then she's going around on one of those little scooters with her knee up in the air. This is a nightmare for this lady. And the problem was there was no end in sight without a surgery. So we go to mediation because we're getting ready to go for trial. And the judges in Colorado always order mediation before trial. They force you to a mediator. So go to the mediator, and it was actually a mediator who was an ex-judge. And he comes into our room first. There's, attorneys are in one room and they're in another room. And he goes, Doctor, I got to hear what you're thinking here. Like, I'm not getting it either. I'm not getting this. See, before you go in, everybody sends in kind of, what your injuries are and what you're pursuing. He's like, you got to explain this to me before I can even go in there. Well, I'd had the animation, the MRI and everything ready, and I showed it to him. He was like, my gosh, wow. Oh, there's no doubt this is from it. And he goes, so he leaves the room and he goes to the other room with the other side. Now, keep in mind, they had offered us like $0, okay, $0. And he goes to the other side and talks to them for a bit, and he comes back and he said, I haven't really done this in a long time, but do you mind going over there to their room and showing them your animation and what you're going to present at trial? Do you mind showing that to them? Because I just think it'll change everything. I said, sure. Yep, no secrets. I didn't care if they saw it early before trial. I don't care if they know. It's the truth.
Yep.
The truth's going to come out. Let's go show them the truth. So we literally got in the same room. We plug in the animation. We put it up on a TV screen, and I play it, and I just kind of walk the insurance adjuster, the defense attorney. I walk them through it, and I show them all of this, and okay. We leave the room, and About 30 minutes, 45 minutes goes by, and they came over and they said, "Ma'am, we'll pay you the $500,000.
Wow.
From zero to that. And it just took the understanding, and that's what makes us different, makes us better. And I love doing that. I'm passionate about doing that. I enjoy doing that. That's what makes my day rich. And I work with a bunch of people like yourself who enjoy doing that, who find the richness in your day of doing that for people. And so it's not just a slogan, and it's why I went into law.
Man, well, this has been a spine tingler. Like we talked about the spine, we've talked about major injuries, minor injuries, chronic pain, things to treat, experiences and stories we've had. Yeah. I've had a great time. Yeah. I hope that if you've been watching this and if it's made a difference for you, you'll know that this, if you have questions, this is a place where you can go to ask. You can reach out to me, Jim at ramoslaw.com, and we can get questions, we can field them, we can answer them, we can get them right back to you. But also, if this has been helpful, will you share this with someone that needs to hear it? Or even if someone's not been in a crash or anything, this is about understanding how the body works. And so if you know someone who's been in a crash, and send this to other people around them so that they can understand why they might not quite be acting the same, that'd be really helpful. And of course, subscribe to our channel. That's the best way to support us, to let us know what you want to hear and what you want to see. And we'll keep trying to do what we do in making a difference while you keep making a difference as well.
Absolutely. Yeah, couldn't say it better. Thank you guys for your trust and your belief in us. And again, it does help when others get that opportunity as well. And we hope that you will message in and tell us what you want to hear about, because we love talking.
We do. And maybe we'll talk about our Audible topic next time.
Yeah, I'm excited about
Perspective changes. So
Pleasure.
You guys take care, have a great day, and keep making a difference.